leaders in Louisville say we are really facing two pandemics right now, both COVID and gun violence.
In a public address yesterday, they shared research and findings that show a dramatic rise in injury and death, both from infectious disease and from violence.
And Rob's here to share. Rob, the big takeaway is not just that we are facing these two problems, but that they're linked to each other.
Yeah, and that's the big thing, Haley, that our health leaders were trying to drive home yesterday, that beyond the direct health impacts of the spread of the coronavirus, the pandemic has impacted our mental well-being too, and that has many ripple effects. COVID has increased depression, anxiety, and isolation for many of our neighbors, and that increases the risk of violence, both against oneself and also towards others. The Metro Department of Health and Wellness shared these graphs during a virtual meeting yesterday. And as you can see, there is a huge jump in 2021 in the number of suicides. And for homicides, we've seen a year-over-year climb since 2018. And it's important to remember that we still have 3 more months of 2021, so we can expect these graphs to climb even more. Louisville's not alone in this. Studies from universities and public health leaders have found similar trends across the nation. From Pennsylvania to New York to California, our health leaders say that viewing gun violence as an epidemic is important for the best understanding of it, but it may also help us find solutions. We can think of it as a public health problem rather than a moral failing. And if we do that, we might start using some of the tools we've used to fight COVID. We can contact trace, so to speak, identifying people in groups who are most vulnerable and then working to prevent ripple effects of violence. And we can also find certain comorbidities that make some of us more in danger of violence than others.
Individuals who get in front of the transmission of violence, and the goal is to isolate that infected person, treat and rehab that individual to keep violence from spreading to the next person. But we know that strategy is only a part of the puzzle. We also have to be heavy on our prevention side.
Now, the next step, like with COVID, is to direct more helpful resources to the communities at risk and make sure there are mental health support systems in place in advance. And that, our health leaders say, can start in our churches and schools for our young people. Haley?